Good afternoon. Today's topic is pharmacovigilance. It is a science and activities relating to the detection, assessment, and understanding and prevention of adverse effect or any other possible drug-related problems. The aim of pharmacovigilance is to improve patient care, safety related to use of drugs, promote rational use of medicine, develop regulation for use of drugs, and educate healthcare professionals about the adverse drug reaction. Causality assessment. Some of the commonly used tools for the causality assessment are Naranjo scales and WHO scale. The National Pharmacovigilance Center is located at Ghaziabad. The International Center is Upasla Monitoring Center in Sweden. Any healthcare professional, example doctor, dentist, nurses, and pharmacist, can report a suspected adverse drug event. Patient can also report adverse drug reactions. The second topic is treatment of poisoning. Toxicology is the study of poison, their action, detection, prevention, and treatment of poison. All poisoning cases requires hospitalization and careful observation till recovery. Poisoning may be suicidal, homicidal, or accidental. All cases of poisoning are medico-legal case, hence the police should be informed. General management. First, hospitalization. 2. Airway should be cleared. In comatose patient, there is a danger of respiratory obstruction by tongue, secretion and aspiration of vomitus. Hence, the patient should be turned to his left lateral side. A cuffed endotracheal tube should be inserted and secretion should be aspirated regularly. Breathing should be assessed. If there is hypoxemia, oxygen should be given. Patient may need mechanical ventilation if there is any respiratory insufficiency. Circulation should be assessed, pulse rate and blood pressure, and an IV intravenous line should be maintained. Fifth, to prevent further absorption of final poison, for inhaled poison, we should use patient should be moved to fresh air. For contact poison, contaminated clothes should be removed and the body part should be washed with soap and water. For ingested poison, gastric lavage can limit the absorption if done within 2 to 3 hours of poisoning. If patient is unconscious, endotracheal intubation should be done before gastric lavage. Gastric lavage is usually done with normal saline. Other solutions are lukewarm water, potassium permanganate solution, sodium bicarbonate, etc. Lavage should be repeated till the returning fluid is clear. After the lavage, activated charcoal is administered, which absorbs the many drugs and poisons. Activated charcoal has a large surface area and is highly porous to bind with poisonous material. Gastric lavage should not be carried out in cases of poisoning due to corrosive except carbolic acid, petroleum product, and convulsants. Mustard, common salt syrup, ipecac, and can be used to induce vomiting and prevent further absorption of ingested poison. However, this method is rarely practiced now. Laxatives like magnesium sulfate or citrate can be orally given to promote elimination of the ingested poison. Oral polyethylene glycol electrolyte solution can be used for whole bowel irrigation of gastrointestinal tract in case of poisoning due to iron, lithium, cocaine, heroin, and foreign bodies, etc. Then we should use do the symptomatic treatment. For example, intravenous diazepam 5 to 10 milligram if there are convulsions and external cooling for hyperpyrexia. Maintenance of fluid and electrolyte balance. Hyponatremia should be treated with IV normal saline and hypernatremia should with furosemide. Hypokalemia is treated with potassium chloride, oral or slow IV infusion. Oral potassium chloride should be diluted in a tumbler of water to prevent intestinal ulceration. Potassium chloride should be given with slow intravenous as it has cardiac depressant activity. Rapid injection can cause cardiac arrest and death. Specific management. Specific management are some of the antidotes that we give to specific poisoning. For example, if the poisons are due to alkalis, we use dilute acetic acid or vinegar. If the poison is due to organophosphorus compounds, we use antidote as atropine. In morphine poisoning, we use naloxone. In atropine poisoning, we use physostigmine. In benzodiazepine poisoning, we use flumazenil. In carbamates poisoning, we use atropine. In cyanide poisoning, we use sodium nitrite or sodium thiosulfate. In methanol poisoning, we use ethyl alcohol and fomepizole. In paracetamol poisoning, we use N-acetylcysteine. In heparin poisoning, we use protamine sulfate. In warfarin poisoning, we use vitamin K. And in iron compound poisoning, we use desferrioxamine. Pharmacoeconomics. It is a scientific discipline that deals with the evaluation of cost and consequence of drug therapy or other interventions to healthcare system and society. The commonly used pharmacoeconomic analytic methods are cost minimization analysis and cost effectiveness analysis and cost benefit analysis. Thank you for today's topic.